Check online. Yeah. Check online. Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. And thank you, Dr. Teja, for joining the session. Is the voice loud and clear? Yeah, great. Good. So I'm very happy to see almost 5 online classmates. So we are starting preventive medicine. SPM is also called sleep promoting medicine because it makes us very sleepy to master so many facts in the preventive medicine. So with that preamble, I'm going to promise you that in the next 4,500 points, we are going to revise in the next 30 hours. I'm going to make you the champion in preventive medicine, with which you will be able to get easily 20 out of 20 scored in the tomorrow's NEET PG exam. There is a notes which I have given to you. Every day evening 6 p.m. to 8 p.m. we have a live class. So please do come to the class. If you are in Hyderabad, come to Nampally. If you are unable to come, at least attend online, right? So that's the plan. Let's make the great beginning. Standard of living. So you should know that standard of living obviously depends on per capita. So what is meant by per capita income? Why we call America a rich country, India developing country, everything is money, honey. So the total income of the individuals 15 years and older in a specific area by the total population in that specific area will give you the per capita income. And if you take the entire country, every country has a per capita income. So that is the one which decides the standard of living is what you need to remember. HDI, Human Development Index. So what is this? There are 3 components of HDI, which you need to remember. Longevity, which is decided by the life expectancy at birth. Income, which is the real GDP per capita. And the knowledge, which is the mean years of schooling. And the gross enrollment to the schools. And the literacy rate. They all decide the Human Development Index is what you need to basically remember. Now, what is the HDI value? It ranges between 0 to +1, 0 to +1. Obviously, the next question is, what is the HDI of India? So you have to be 100% sure. 0.554 is the magic number that you need to remember. And what is the rank of India in Human Development Index? 136 out of 186 countries. So these are the numerics that makes the SPM a truly sleep promoting medicine. But still we need to master, because you need to dream only one thing. I'm going to take MD General Medicine, then DM Cardiology. I'm going to be the top cardiologist of the life. If you have that dream, you will get that power to assimilate and reproduce in the tomorrow's exam and win over the top rank. So that's so 2 things, doctor, to become a topper in NEET PG. Dream big, think big, and go with that focus. So in preventive medicine, there are totally 4,500 points. ENT, there are 2,500 crystal clear points that you have to master, and to do that, your job is very easy. Attend Dr. Murali Bharadwaj every day evening 6 p.m. to 8 p.m., Monday to Saturday. And on Sunday, there is a grand test from 9 a.m. to 12 p.m. and discussion 12 p.m. to 3 p.m. You do this 48 weeks with me. So every day evening 2 hours into 6 days is Monday to Saturday 12 hours. And Sunday you are investing 6 hours with me. 18 hours per week into 48 weeks, which is almost 900 hours. 900 hours आपका जिंदगी मुझे दे दो. आपको नीट पीजी में 900 के अंदर नहीं आए तो रैंक, मैं टीचिंग करना बंद करूंगा. Right? So you have to give me that promise to be persistent, perseverant, and to be part of the mission. So physical quality of life index. What are the 3 important indicators? Life expectancy at 1 year of age. You remember, for HDI calculation, we use life expectancy at birth. But for physical quality of life index, we use 1 year of age. That is what you need to be very clear. LE1. Infant mortality, literacy rate. These are the 3 parameters of PQLI is what you need to remember. Obviously, the next question comes. What is the value of PQLI in India? 65, 65, 65. You need to remember. Can you give me that water? Yeah. 65 is what we need to remember. Now, what are the components? Thank you. Components of human poverty index. One side, if it is development, what is the antonym of development? Opposite of development, poverty. So, what are the components of human poverty index? We basically use 2 types. One is for developing countries, other for developed countries. In developing countries, HPI is having 3 important parameters. Number 1, the probability at birth of not surviving up to age 40. If you are in Afghanistan, there is no guarantee that you will live a full life. Adult illiteracy rate. बड़े होने के बाद भी पीजी एंट्रेंस को प्रिपेयर हो रहा. Adult illiteracy rate. And there are 2 other indicators. Their average is taken. The population not using a improved water source and children underweight for age. So these are the components of the human poverty index is what you need to basically remember. Whereas if you go to developed countries, what are the components of HPI? Probability of at birth of not surviving until age 60. Whereas in poor countries, it is up to 40. And adults 16 to 65 who are lacking the functional literacy skills. Functional literacy skills. That means you have to write a letter to the consumer court. Sir, this object is not good. So I want the refund of my money. So to write such letters, you require functional literacy skill. And percentage of the people who are living below poverty line and the rate of long-term unemployment, 12 months or more if you are unemployed. They are the components of human poverty index in developed countries. So developed countries is all about jobs are there or not. If you are able to provide jobs in a developed country, then you will win as the president of that country is what you need to remember. Now, doctor, the next important thing is, what are mortality indicators? What are morbidity indicators? Fatafat bolna. Crude death rate, expectation of life, infant mortality, child mortality, under 5 proportional mortality, maternal mortality, proportional mortality, disease specific mortality, ये सब होता है mortality indicators. Then what are morbidity indicators? Morbidity means the suffering due to disease. Mortality is the death, altogether death. Incidence and prevalence are morbidity indicators. Similarly, notification rate, attendance rate in the hospital, how many are coming to hospitals, admission, readmission, discharge rate, and duration of stay in the hospital, and the spells of sickness, they all talk about how much we are suffering because of the disease. They are called morbidity indicators. Now, if you look at the life expectancy, how long you will live in the country. Recently, our life expectancy has improved in India. So earlier it used to be 60, then 65, now 70, etc. So life expectancy is a positive mortality indicator, is what you need to remember. Sullivan's index. So what is Sullivan's index? Life expectancy minus duration of disability. How long you are lying down in bed without unable to get up, and inability to perform the major activities. So that is called duration of disability. So if you are expected to live for 70 years, if 40 years you are staying in medical college and preparing for entrance exams, that also is a disability. So we doctors, medical students suffer a lot of disability. No peace to the mind in spite of passing MBBS. Because nobody will give a girl to marry unless you get into MD. After that, the girl will not be ready to live with you unless you are become a top consultant and start earning money. Oh my God. Life, Sullivan index is very high for doctors. So Sullivan's index is the disability-free life expectancy is what you need to remember. DFLEQ. Right? LE. So disability-free life expectancy is Sullivan's index, is what you need to remember. Then you have dailies. What is meant by daily? One of the favorite questions of the examiner, dailies. Daily. Right. So daily disability adjusted life years. It is one of the very good measures of the burden of a disease in a defined population. Suppose if you say, COVID has caused a huge burden on our healthcare system. So you want to know the burden of a disease in a given population, you need to calculate disability adjusted life year. Similarly, you have introduced vaccination. You have introduced supplementing vitamin, iron. You have done some intervention. Then your intervention should decrease the disability caused by the disease. That's the reason disability adjusted life years is a best measure of the burden of disease in a defined population, and also the effectiveness of the interventions in improving the health condition of the population is what you need to remember. So daily is equal to two important parameters, doctor. YLD, which is years lived with disability, plus years of life lost. Years of lived with disability is a burden. And because of the disease, if you died early, then you have years of life lost. So years lived with disability, years of life lost, YLD plus YLL will give you DALY. Daily is what you need to remember. Now, disability adjusted life years, they express the number of years which you lost because of the premature death, plus the number of years you lived with the disability. So YLD plus YLL will give you daily, is what you need to remember. So daily is talking about the years you lived with the disability. That means it is a morbidity indicator. Daily includes years you lost because of the life lost, death. That means daily is also a mortality indicator. So daily is both a mortality indicator and also morbidity indicator. That is what you need to remember in the tomorrow's exam. All these things are very simple, but you need to relate yourself to them. When you are reading gynecology, you should think like a gynecologist. When you read dermatology, you should feel that I'm going to get a scabies patient, pityriasis patient, psoriatic patient. Think like that, you will enjoy the subject. Second, don't prepare for a subject for NEET PG entrance without a finite number of points to master. Your pitch must be decided for you to do the bowling. If your pitch length is not decided, how can you do bowling? You ask Bumrah to do the bowling to about 2 pitches length. Can he be as effective as 1 pitch length? No. So if you take social and preventive medicine, totally 4,500 points are there, doctor. In this, almost 2,000 points. At least once if you know, you will remember it forever. Right? Daily means even in sleep you will say disability adjusted life years. How much is the Human Development Index value in India? What is PQLI value in India? Is it 65, 55, 45, 35? You will forget. So such type of points will be around another 2,000. 4,000. 500 points will be requiring some logical reasoning. उसको समझने के लिए जरा अकल होना है, बट्टी मारने से थोड़ी होगा. So finally this 4,500 points you should finish first round of revision in say about 100 points 1 hour, 45 hours you should be done. Right? Second round of revision, you don't need 2,000 points one time, enough. Those things you don't need second time. Second time you only need to go through the 2,000 points which are required second time. So that will take another 20 hours. Lastly, these 500 points are there. Before exam, last 45 days you need to revise. That is how you have to prepare, like you are preparing for a war, for a battle. If you don't have that in mind, somebody will say, "Arey yaar, wo coaching अच्छा है, ये coaching अच्छा है, वो video अच्छा है, ये सब अच्छा है, जरूर अच्छा है, मगर हम पढ़ने के लिए लायक है या नहीं है, वो देखना है पहला." So that's what I'm trying to tell you, doctor. Now, one daily is 1 year of the healthy life which is lost. One daily is 1 year of healthy life that is being lost. Then what is quality adjusted life years? Can the online students punch whether the voice is loud and clear for all of you, doctor? Whether the voice is loud and clear for all of you? So what is quali? Quali is a measure of both the quality and the quantity of the life that the person has lived. Quality of life. रोज मस्त कर रहे, डांस कर रहे, पार्टी कर रहे, किटी पार्टीज हो रहे, जिंदगी आराम चल रहा है. That is okay. That is quality. Quantity. You died by 40, you died by 30, what is the fun? This planet is more beautiful to live. So quality is the measure of both the quality without disease, without disability, with peace, with health, with happiness, right? With the girl whom you wanted or with the boy whom you loved. To live is quality. and quantity of the life lived. So, qualis is the years of the life lived in perfect health, whereas the dailies are the year of life that you lost, right? So please don't forget, one daily is 1 year of healthy life lost. जो खो गया डेली है, जो पाया है वो क्वाली है, right? हाँ. So that you need to be very clear. So where do we use quali? Suppose you have done a medical intervention, you asked the chief minister, you are the health minister, you asked the chief minister, sir, मुझे 100 crores दे दीजिए. If you give me 100 crores, I'm going to make the children, at least 1 million children, from becoming sick and decrease the asthma, refractive errors in schools. So you have taken the money. So how, and you have done some programs in the school, screening and all that, and you spent 100 crores. So with all this intervention, the money you have spent, could you be able to produce that kind of a improvement in the quality of the school children or not? You want to know. How can you know? Quality adjusted life years is the one which you use to measure the value of the money on because of a medical intervention. Then what is YPLL? Years of potential life which is lost. YPLL. And it is based on the number of years which are lost because of premature death. So for example, in a country, 85 years is the expected life expectancy. Koi 80 ko mar gaya, that means what is the YPLL? 5 years. 20 years only he died, that means YPLL is 65. So that is the concept of YPLL is what you need to remember. So years of potential life lost occurs before the age that person is expected to survive. And that's the reason years of potential life lost is an example of a mortality indicator is what you need to remember. So now, doctor, very good to see Medico, Anurag, Pramod Gujjar, Asutosh Maurya, and Sagar. Thank you so much for attending the evening, and many thanks to Teja for coming to the class. I was very much feeling, why don't I sit in the home only and teach? Everything is online. But home we don't get motivation. We have to teach to wall, to camera, not to real jigte jagte human being. So luckily today, after the COVID is over, physical classes restarted. Nothing can beat the physical classes. And though I was a pioneer in online classes for the past 1 decade, when nobody started online classes, we were the only people running online classes 10 साल के पहले. फिर भी 2 साल के बाद मुझे ऐसे लग रहा है, it's like oxygen. To find students is like breathing oxygen. So thank you guys for joining the session. Please tell your friends, post it in your WhatsApp group of your classmates. Our students are our best brand ambassadors. Every day evening 6 p.m. to 8 p.m. we are having the class. Please do come. So what are the socio-economic indicators? Housing, family size, literacy rate, availability per capita calorie. कितना खाना मिल रहा है सबको. And gross national product, GNP per capita, growth rate, unemployment level, dependency ratio. इनको बोलते हैं socio-economic indicators. So preventive medicine MCQs, they look very easy, but examiner will slowly try to mix and match and try to confuse you, and you lose 1 mark. You should not. 8 indicators socioeconomic means 8 only. Huh? Now, doctor, case fatality rate. What is the meaning of it? It is the killing power of a disease. How many cases of COVID happened? How many died? Number of deaths by number of cases will give you case fatality rate. So the number of deaths depends upon the lag between infection and death. And number of cases depends upon how much testing you have done. If you do more testing, more cases will be found. Right? So that's the point you need to appreciate. So what is that indicator closely related to virulence of organism? For example, Omicron is less virulent than Delta. Delta is less virulent than the original COVID-19. After Omicron, Deltacron came. It is much more cheap chitka. Nowadays, our body is not caring because we got herd immunity. See, today morning paper, they said Delhi suddenly cases now increased to 6,000 cases in 1 week. Entire country, they are falling. But the authorities said, no need to worry, there is not going to be any fourth wave because this is because suddenly removing the restriction. Delhi always is much forward than the entire country because they are all capital city, right? So, but our herd immunity is so strong that within no time the 6,000 will become 60 once more. So case fatality rate is closely related to virulence, is what you need to basically remember. So the total number of deaths due to a disease by total number of cases due to a disease into 100 will give you case fatality rate. Now, one of the favorite questions of the examiner. Rate means you should have time in the denominator. But there is no time defined in case fatality rate. So it is not actually a rate. It is a proportion. Case fatality rate is a proportion. And it is expressed as a percentage, right? So number of deaths is numerator, number of cases is denominator. Numerator is a part of the denominator. That is what the definition of proportion is. There is no time involved. That's the reason case fatality rate is a proportion, not a rate. This is one of the favorite MCQ of the examiner. Now, there is something called survival rate. Case fatality is death. If you don't die, what will happen? You will live. So living is called survival. So survival rate is complementary to case fatality rate. And case fatality rate is equal to 1 minus survival rate is what you need to remember. Now, one of the favorite MCQ. Only 4 organisms you should remember case fatality rate, doctor. Favorite MCQ. Not for every organism. Right? So, what to remember? What to read at least once? What to be repeatedly revised during the last 45 days before exam? That need to be defined. Pakka? So, my job is every day I prepare. There are totally 65,000 points. You and me are going to sit together from 19 subjects. We are going to take them out, breathe them, drink them, eat them, assimilate them, and go to the exam confidently. Our examiner को बताएंगे, भैया हम diffusely unfocused कुछ भी नहीं किया, बराबर रेडी है तलवार के तार के जैसे, चमकते हुए सितार के जैसे. So that's what we have to make the examiner feel. Rabies 100%, yellow fever 80%, Japanese encephalitis 30 to 35%, chicken pox less than 1%. These are the 4 common case fatality rates that need to be remembered for the tomorrow's NEET PG exam, doctor. Now, what are the limitations of case fatality rate? Time interval is not specified. Usefulness is only limited to chronic diseases. I mean, in chronic diseases, it can't be used. It is used only in acute infection. It is limited for chronic diseases because only acute conditions, how many people died out of the total cases, right? Like COVID. It is useful, not for chronic like diabetes, hypertension. You can't use case fatality rate. And the case fatality rate of the same virus in different times will keep changing. Omicron versus Delta Cron versus different Cron, depending upon the change in the agent, in the host, and environmental factor. These three are called epidemiological triad: agent, host, and environment. So the same COVID virus, Africa different mortality, China different mortality, India different mortality. So if the host is different, agent, Omicron is different from Pemicron is different from Dimicron. So all this will be different. And similarly, elderly people, elderly person versus pediatric population. Pediatric population don't die at all due to COVID unless you want to kill them with steroids. So that is the reason host also will decide the case fatality. Now comes iceberg phenomena. So what is the meaning of this? If you look at the various clinical cases, you have clinical illness which is visible. There is a death which is visible. Then there are asymptomatic infections which are invisible. Similarly, carriers are invisible. So what you are seeing today in community is only the people who are having fever with COVID. There are so many without fever subclinically with COVID. So that is the reason what physician sees in community. What a physician sees in a community are all the clinical cases, which is the floating tip of the iceberg. Then vast submerged portion, that is latent, inapparent, symptomatic and undiagnosed, which clinician is not seeing, and carriers, they all are the hidden part of the iceberg. And there is a line of demarcation between these two, which is between apparent and inapparent cases, is what you need to remember. So one of the favorite dictum, epidemiologist is concerned about hidden part of the iceberg. Clinician is concerned about tip of the iceberg. Screening we do for hidden part of the iceberg. Screening for hidden part of iceberg. Diagnosis, clinical diagnosis, COVID test positivity, that is all for the tip of the iceberg of clinical cases. So one of our PSM professor used to say, Dr. Salunke is saying, good evening, sir. I will give my MD PATH exam in a week. Need your blessing. Once preparing for NEET PG, and then time just passed so fast. So we have wonderful guys like Dr. Salunke across the country. So the pleasure of being a teacher, of course, is to take a tuition fee from you. No doubt on that. Nobody is doing it for charity, but definitely that is a small part. It's a tip of iceberg. The submerged part of the iceberg is when we listen that you have finished your MD, you are also becoming professors, assistant professors, settled in life, and once upon a time during your journey, we were your classmates. Same tradition you should continue when you become teacher. Right, doctor? When you become postgraduate, take every chance to spend some part of time with your juniors who are preparing for exam. So what are you going to tell them? East or West, Murli Bharadwaj sir is the best. Okay, good. Thank you, Dr. Salunke, for joining. Definitely, you will be in flying colors in MD pathology. Now, doctor, iceberg phenomena of a disease you don't see means there are no subclinical cases, no asymptomatic cases, no carriers. What you see is only clinical, only the no iceberg phenomena. Where this is a favorite MCQ of examiner. एक बार second revision 2000 points second revision है ना, second quoting में डालो. Your job is very simple. I give you all this as a 120 pages notes. That requires second quoting, tick करो बस. Whenever you get time, second quoting को दोस्तों के साथ revision करो बस. And you take another color pen or put a circle on those points which require last 45 days, 500 points. Bas. That's all. And those which you don't need to remember, don't tick them. Simple. Okay? So that's how 65,000 points checklist we are going to do the revision, doctor. Rabies, tetanus, measles, rubella. There is no submerged portion of the iceberg is what you need to remember. Now, doctor, pre-pathogenesis, pathogenesis phase. So, pre-pathogenesis means before the onset of the disease. The phase is called pre-pathogenesis phase. The period before the onset of the disease in man. That means man is at risk. So what is the epidemiological triad? Agent, host, and environment. Now, where will you do primary level of prevention? Primary level of prevention. So you should remember, primary level of prevention is done at pre-pathogenesis phase. Please don't forget, doctor. Favorite MCQ, exam hall में guess मारने वाला चीज नहीं है ये. Primary level of prevention is done at pre-pathogenesis phase, before the disease started. For example, you are giving vaccination. So you are doing primary level and you are approaching before the disease started, before polio started, before COVID started, you are giving vaccination. Pre-pathogenesis phase. Then pathogenesis phase is from the point entry of the organism happened in a susceptible host, pathogenesis phase will begin. Then the multiplication of organism, disease initiation, and the progression, they all occur during the pathogenesis phase of the disease is what you need to remember. And what is the final outcome that happens during the pathogenesis phase? There can be recovery, there can be disability, or there can be death. There are only three possibilities. Either you will get the seat in first counseling, or you will get the seat in next counseling, or you will prepare once more for exam. Only three things. Lot of people come and tell, hey, notification आ गया, last 30 days, lot of tension, man. Oxygen नहीं मिल रहा है मुझे, oxygen dissociation करो, left हो गया, right हो गया. कुछ भी नहीं है, that's all drama. No need of drama, right? So only three things are possible. Now, during pathogenesis phase, what can happen to the host? He can become a clinical case, or he may be subclinical without any symptoms, or he become a carrier. Any of these are possible during pathogenesis phase. Now, where will you do secondary level of prevention, tertiary level of prevention? Primary level is done at pre-pathogenesis phase. Secondary and tertiary level of prevention are done during the pathogenesis phase, is what you have to emphatically remember. Now, screening of a disease. Why do we do screening? क्या फायदा है? Screening karne se you can diagnose it very early and start treatment so that ultimately prognosis will improve. And you diagnosed it early so that you started treatment so that survival, otherwise he would have died. Right? So survival, prognosis, both the things increase with the screening. So examiner tomorrow's exam will play with you. Will it increase only prognosis? Will it increase survival? Or increase both of them? So you must be very sure. Yes. Then comes surveillance. So what is the definition of surveillance? Ongoing. It's not 1 day, 2 days. Ongoing, like our daily NEET PG classes. Ongoing, systemic collection, analysis of the data, and the provision of information that lead to the action taken to prevent or control the disease, generally infectious diseases. So you are going house to house and doing survey. Fever is there, amma. COVID aa gaya, amma. Then you did analysis of the data. Then you came back to the primary health center. Then you told the doctor that as a health worker, I went to every house and find out how many people in that village have COVID, how many got vaccinated. You collected all that data continuously, right? That is surveillance, is what you need to basically remember. Surveillance has two types: passive surveillance, active surveillance. What is the meaning of passive surveillance? Basically, the data is itself reported to the health system. That means a person who is sick came to the PHC, reported he is having fever. That is, then you informed the data and analyzed the data. That is passive surveillance. Active surveillance. Your health worker went to the patient's home and collected data. Anybody with fever, anybody with cough, weight loss, TB, night sweats, you took the data. That is active surveillance, where you went to community to collect data. So a patient with a fever coming to the PHC, CHC, dispensary, private practice, hospital, all the data is passive surveillance. And a health worker going house to house every fortnight to detect the fever cases, collect the blood slides under the malaria control program, for example. Malaria control program, you are collecting the blood slides by going to the patient's home, taking a sample. That is all active surveillance, which is done, example, under NVBDCP, National Vector-Borne Diseases Control Program. Initially, our people tried malaria control separate program, dengue control separate program. Finally, government don't have that much money, so he merged everything and now made a vector control borne diseases program. Most of the national health programs today, what we do is mainly passive surveillance, not active, and morbidity, mortality data collection, not active surveillance. But NVBC, right, National Vector-Borne Disease Control Program, we do the active surveillance. So please remember that. Now, active surveillance is basically done in only two conditions. One is NVBDCP and in NLEP, Modified Leprosy Elimination Campaign also. Our health workers will go there. That's the point you need to remember. So one of our professors of preventive medicine used to say, when the disease is abundant, right, all the money is burnt in the medical college attached hospital. Still people die. When the disease has become very rare, we use crores of money on preventive and social medicine department to send our health workers on a holiday to the patient's home and do the active. The more and more rarer the disease become, more and more money will be available for the PSM department to do the surveillance, active surveillance. More and more the disease is abundant, patients themselves will come to the hospital and all the money will be taken away by the hospital guys. That's the point. So, sentinel surveillance, what is the meaning of it? There are certain specific conditions. They keep their incidence prevalence keep changing. So, to assess the stability or the change of a particular disease and the health levels in a population, we do sentinel surveillance. So, it is the study of disease rate in a specific population to identify the trend that happens in larger population. Means you have gone to 2 colonies, taken the data, and from that data you extrapolate it to the entire Hyderabad city. That is one use case of sentinel surveillance. So sentinel surveillance is the study of the disease rate in a specific population to estimate the trend in the larger population is what you have to emphatically remember. Now, the health practitioners also use the sentinel surveillance to monitor the trend of the health event in the population. So how was the COVID level in 2020? Then it increased, then it changed, then spiked. All that we do know. So that happens because of the sentinel surveillance basically. Then one more thing, sentinel surveillance, favorite MCQ entrance. Sentinel surveillance identifies missing cases. It also takes these missing cases and supplements them to the notified cases. So, for example, you are doing a quick survey for the polio, acute flaccid paralysis in a community. When the health worker has gone, what the health worker will ask the villager, Amma, आपके घर में कोई पोलियो वाला है क्या, कोई जिसका पाँव हाथ गिर गए हैं? What will villagers will say? You think villagers will be always available for giving an interview for you? No. I'm very busy. Morning I went to the field to do the work. Then my sir is going to come. My children from the school. I'm very busy. Don't go away. I will talk to you later. So there may be a flaccid paralysis case in the home. So there is a missing case. One more health worker will go and then pick up that missing case, right, which is missed in the earlier survey, and supplement to the notified cases. That is what sentinel surveillance, missing cases, you should remember. So where do we do sentinel surveillance? National AIDS Control Program, where you have STD clinics, antenatal checkup clinics. They're the sentinel sites to monitor the trend of AIDS. Okay, so that is very important point to remember. So what is monitoring? Monitoring is the performance and analysis of the routine measurements aimed at detecting the change in the environment or the health status of a population. So how much of suspended particles are there in the air? You are monitoring. Today, the cloudiness index of Delhi city is high, Hyderabad is less. So you are looking for the suspended particles and monitoring pollution. So monitoring is analysis of the routine measurements like the suspended particles in air, carbon monoxide levels in air, right? Wherever chaurastas are there, where a lot of traffic jam is there, their carbon monoxide levels is high because of that petrol exhaust, right? So That is the monitoring. So now there are 3 points you need to know which are frequently asked in the exam, tomorrow's exam. 3 points, 4 points you need to remember. Monitoring is a one-time linear activity. One-time linear activity. No feedback is there while you are doing monitoring. No inbuilt action component, because pollution is this much, stop the people living in that city, make them, take them away. You are not doing that. So no inbuilt action component. And monitoring is stopped once disease is eliminated or eradicated. And compared to surveillance, which is not a one-time linear activity, right? Monitoring is a one-time linear activity. So that's the reason it is a smaller concept compared to surveillance. So you should know the differences between monitoring versus surveillance. One of the favorite question of the examiner. Whereas surveillance, jo hota hai, it's not one time. It is a continuous scrutiny of the factors which are deciding the occurrence and distribution of the disease is what you need to basically remember. Right? So that is the monitoring and surveillance ka story. Now, surveillance, what are the 5 points you need to remember? It is continuous. Feedback is there. There is an inbuilt action component which is there. And it continues even after the disease is eliminated or eradicated. Even disease eliminated, eradicated hone ke baad bhi surveillance continues. Is it there? Is it there? Is it there? Is it there? You are a doubting Thomas if it is surveillance. You are only Sherlock Holmes if you are monitoring. Right? Broader concept compared to monitoring. That's the point. So, disease control is mainly for primary and secondary level of prevention. Always remember, secondary level means early diagnosis and treatment is secondary level of prevention. So primary and secondary level of prevention, you are doing disease control. Disease control. So what is control? What is elimination? What is eradication? You have to be 100% sure. So what is the sequence of disease control? First you will control, then you eliminate, then you eradicate. Right? Control, eliminate, eradicate. It's like disease control. You fell in love, eliminate, you married, you eradicate, you divorced. So that's what are the 3 sequences. So control, what is the meaning of control? You will reduce the transmission to such a low level that it stops to be a public health problem. Right? These things you have to be very sure. Examiner will ask, if you reduce the transmission of a disease agent to such a low level that it stops to be a public health program, do you call control? Do you call elimination? Do you call eradication? Everything looks same in the exam hall. If you are not prepared and gone to the exam, don't guess in the exam hall. Right? Then, what are the 4 main purposes? Why do you do control? Control karne se incidence of the disease decreases. That means new cases will come down. Similarly, control say duration of the disease is decreased. Effect of the infection decrease. Financial burden of the community will decrease. All the 4 will decrease with the disease control. So examiner tomorrow will ask you, is it only incidence? Is it only prevalence? Is it only duration? You should tell, no sir, all 4. Right? Then, elimination. With elimination, you are complete interruption of transmission of the disease in a defined geographical area. But the causative organism is persisting in the environment. Right? So, for example, if you take Andaman Nicobar Islands, Let us say COVID is still there, but everybody in that island is 2 immunizations, booster dose, everything is being given. So even the causative agent is there, you are interrupting the chance of transmission in the Andaman Nicobar Island. So that is the elimination. Then another important point you need to remember is disease elimination is not a global term. It is only geographical term. That is, in a particular region, in a particular country, you are preventing the transmission. That is called disease elimination. Right? Why people praise the Honorable Prime Minister, or for that matter, the wonderful chief ministers or politicians who helped? Because we are able to, in such a populous country called India, where we hug everybody and we jump on each other in the queue, and we almost give a French kiss in the city bus, right? Every time the bus is stopping, we are able to control the COVID. It's not a big challenge to control it in America. America is 7 times bigger than India and half the population, not even half the population, right? So there the density is very less. Even people and their cat, dog, pig also can be vaccinated. That many vaccines are available. To control in America is not difficult. In India, we eliminated. That is great, right? So disease elimination is a geographical term, not a global term, where in a particular country or region, you have eliminated. So what are the diseases? India has eliminated 3 diseases. Guinea worm, dracunculiasis on February 2000. That is the year, that is the month and year exactly I started the PG medical entrance coaching about 22 years ago, right? So I wrote a review book on JIPMER question papers that was launched by Paras Medical Books. In the same, we kept pamphlets and told that, hey, we are starting coaching program, come down. So Feb 2000, dracunculiasis. Leprosy, December 2005. That is the time where I finished my MD. Elimination criteria is less than 1 per 10,000. And yours in September 2006. Now, what are the next set of diseases? 4 diseases which are likely to be eliminated. Please don't forget. Poliomyelitis is likely to be eliminated. Neonatal tetanus, because of our wonderful national programs. Kala Azar, all that hepatosplenomegaly, right? Then Leishmania, Donnellman bodies. Lymphatic filariasis, 4 conditions. So this kind of questions, na 500 list mein jana hai. Because tomorrow you will forget them. 10 times you read also, you will forget. Last 45 days. So please don't forget. Even the online students, we will give you the printed copy, printed notes, 2,500 pages notes, containing 65,000 high-yield facts from 19 subjects. So your job is only this 2,500, like the Harrison Bible, that should be there. Only out of 65,000 points, around 15,000 points you will need second time. 40,000, almost 50,000 points, one time you learn also, you'll remember it lifelong, right? If the tomorrow's examiners 200 MCQs don't come from this 65,000 points, I'll cut my ear, right? Definitely aayega. How much time do we take for the 65,000 points to be mastered? Hardly 650 hours to 1,000 hours, let us say. One round with Murli Bharadwaj. So please do spend every day evening with us, and I will definitely hold your hand and make you the topper one day. So, doctor, disease eradication means complete extermination of the organism. From where? Across the world. Tear out by roots is eradication. And disease eradication is an all or none phenomenon. Either you eradicated or you did not in the middle of the two. Full pregnancy, no slight pregnancy. So, disease eradication is a global term, unlike elimination, which is a regional geographical term. Global, pura planet Earth se remove kar diya. And there is only one disease which we have eradicated, and that is smallpox, which is declared eradicated on 8th May 1980, is what you need to remember. Now, what are the three next target diseases for global eradication? Please don't forget. Right? So, polio, and this is all measles. So, your children are going to study measles as an eradicated disease when they become medical students. Then comes guinea worm. Guinea worm, India eliminated, shortly, globally ready to get eradicated. Now, doctor, comes the levels of prevention. One of the favorite MCQ of the examiner. Primordial prevention. So, what is the phase of the disease where you do primordial prevention? Typically, underlying conditions lead to causation. Right? Objective is to minimize the hazard to the health. And how will primordial prevention occur? It is a personal effort, community effort. For example, stop smoking. Smoking is a risk factor for many things. Stop smoking is a primordial prevention. But who has to do stop smoking? Patient has to do. So personal and community effort. Vaccination you have to give. But stopping smoking is what patient has to do. So that's the reason, personal and community effort. Understand? And smoking lead to cancer. So underlying condition that you are preventing is a causative factor. And the objective is minimize the hazard to health. Of course, smoking is pleasurable. Drinking is pleasurable, but it is hazardous to health. That is what you are controlling. And the whole population or a selected group, anybody is a target for primordial prevention. Then coming to primary prevention. What is the phase of disease that you are trying to reach out? Specific causal factor. Smoking is general, or brushing the teeth 2 times a day is general recommendation. To eat nutritious food is a general recommendation. But specific causal factor you control in primary prevention. With primary prevention, you reduce the new cases, incidents. You will inhibit the emergence of risk conditions. And it is the personal community effort, once more. And total population, selected groups, and individuals also are the target of primary prevention. Then comes secondary prevention. So which phase of the disease you are attacking? Early stages of the disease with the early diagnosis and early treatment. So early stage of the disease you are preventing in secondary prevention. The purpose is, with the secondary prevention, it's not about the new cases. It is about the existing cases. You are doing a early diagnosis and treatment. So by that you are shortening the duration, reducing the prevalence, because prevalence is equal to incidence into duration will give you prevalence. If you decrease the duration, you will decrease the prevalence, is what you need to remember. Similarly, early detection and a prompt intervention with the treatment is secondary. And individuals already have the established disease. This is ho gaya unme. And that you are doing early diagnosis and treatment. So, individuals with established diseases, you are doing secondary prevention, is what you need to remember. Tertiary prevention, already burnt out. Late stage of the disease, you are reducing the complications. You are decreasing the impact of the long-term disease, disability. You are minimizing the suffering. All those things you are doing, right? So, हाथ जलने के बाद बरनाल लगाना, वो होता है tertiary prevention, right? And the target is already he is a patient. Whereas in the secondary prevention, there also the target is a patient with an established disease. All right? So, which phase of the disease, what is the target we are achieving? In each of these levels of prevention, there are samajhna, right? It is easy, but एक बार मुरली भरद्वाज के साथ रिविजन करें तो याद रहेगा. So, primordial level of prevention, right? So, primordial, primary, secondary, tertiary. So, primordial level of prevention, the prevention of the emergence of the development of the risk factors in the countries or populations where they have not yet appeared. So, for example, population are school children, right? School children have not yet started smoking. So the risk factors have not emerged in that population group, school children, right? And you are telling them smoking is bad. That is called what? Primordial prevention. You gone to medical college, second year students in Guntur Medical College, already they will tell you what the different brands available and how cocaine is different from this, etc., etc. That is what already there is an emergence of risk factors. Still, if you teach them why smoking is bad, that is primary level prevention. Then you have gone to all the Doctors Association members. Those fellows smoked, and they developed emphysematous lungs. Right? There you told them, Arre Baba, stop smoking. Right? There you are almost rehabilitating them, tertiary prevention. And some of them are only coughing, but still their lungs are intact. Then early diagnosis and you did HRCT, found minor changes, and you started them treating their lung changes. That is secondary. Already cancer developed. If you have gone to 65-year-old guys in the Doctors Association, that is tertiary prevention. Understand? So primordial level of prevention, the prevention of the emergence of the risk factors in the population in which they have not yet emerged, is primordial. Already emerged, that is primary. That's a point you need to remember. So primordial is one kind of primary prevention. A little early, when the risk factors have not yet emerged, is what you need to basically remember. Right? So FMG 2022 is asking how to buy this book of these notes. So please do call 9000-868-356 and we will provide you the printed study material. Sir, what is the strategy in the last 30 days? Do yoga asana and manage your anxiety levels. Ideally, you are feeling anxious means you are not going to make it. Right? So that is the reason. Don't feel anxiety, enjoy. There is no special strategy. Probably you follow with us 65,000 points, notes, 2,500 pages if we give you, and you marked what points to revise in last 45 days, then there is something that is helpable factor, right? So no worries, enjoy the game. So primordial level of prevention, how do you do primordial level of prevention? Individual education and mass education, they are the two things. And primordial level of prevention is best for where? For which kind of conditions? NCDs, non-communicable diseases like hypertension, diabetes, stroke, asthma, they are all non-communicable. There, even before emergence of risk factor, you can prevent most of the times. Now, primary level of prevention. You have taken an action prior to the onset of the disease. Okay, last 1 year you are smoking, right? Still your lungs are not yet affected. So prior to the onset of the disease. So health promotion, specific protection, health promotion, specific protection. These are the two interventions of the primary level of prevention, whereas in the primordial level of prevention, individual education, mass health education, they are the primordial level of prevention. Please don't forget, examiner कल पूछेगा आपको, भैया specific protection, health promotion कहाँ आएगा? वो आएगा primary level of prevention is what you need to remember. So what is health promotion? You want to strengthen the host by the varieties of approaches. Strengthen the host. Then example of health promotion. 4 examples of health promotion. Don't forget, this is one of the favorite multiple choice question in the tomorrow's exam. You are doing health education. Health education का objective क्या है? उसको डराना नहीं, उसको रुलाना नहीं, right? उसको educate करके उसको समझदारी लाना. That is the main idea. So health education, environmental modification. If you are coming on the elevator, there is written every day GHMC, Greater Hyderabad Municipal Corporation, is requesting you every day take 1 hour time or weekly once. You take time, all the community come together to clean the community together. That is environmental modification. Right? Then third is nutritional intervention. Lifestyle and behavioral changes. They are examples of health promotion is what you need to remember. Then what is specific protection? You are targeting through a specific intervention. For example, you have given vitamin A to all school children to prevent blindness. One of the examples of specific protection. Okay? Specific protection. So, yes. Specific protection. So, contraception, vaccines, they're all what? Specific protection. Then, primary prevention is basically applied when the risk factors are present, but the disease is not there. Right? Then primordial is applied when risk factors have not yet emerged. That's the point you need to appreciate. So primary level, you are intervening in the pre-pathogenesis phase of the disease is what you need to remember. Whereas secondary level, already the disease has progressed to the incipient stage, and the idea is early diagnosis and treatment to prevent a complication. Now, for secondary level of intervention, what are the modes of intervention? Early diagnosis and early treatment. Diagnosis and treatment. That is a secondary level of prevention. So, early diagnosis in the secondary level of prevention can be able to detect whether any biochemical imbalance is there, like cholesterol level elevated. Still heart attack did not happen. But much earlier you identify. Similarly, any functional change, morphological change, it is still reversible even before signs and symptoms. That is what early diagnosis is going to do. Early means what? So, sputum smear for AFB, peripheral smear for malarial parasite. What are you doing? You are doing an early diagnosis. That's the reason it is an example of a secondary level of prevention is what you need to remember. Now, what is the purpose of treatment in secondary level? You are shortening the period of communicability. By treating, if you have given treatment to TB, you are preventing the person's kid. Even if he get exposed already, if you have started chemotherapy in the father, chance of communicability are lesser. So treatment aims to shorten the period of communicability, reduce the mortality, prevent the occurrence of the new cases, secondary cases. So secondary attack rate will come down and any long-term disability will come down. That is the treatment in secondary level of prevention. Direct observed chemotherapy, direct observed therapy, short-term, dots, multi-drug therapy in leprosy. You are decreasing communicability. You are preventing the complications. So examples of treatment in secondary level of prevention. So when do you apply secondary level? Already disease is set up. And secondary level will arrest the disease process. And it will identify unrecognized disease. And it will treat it before irreversibility. And it reverses the communicability. They are all the things that are achieved by secondary levels of prevention is what you need to remember. Now comes favorite MCQ of examiner. National health programs by the government of India. National malaria program, TB program, COVID program, all programs. They operate at the secondary level of prevention. That is what you need to basically remember. Secondary level of prevention is an imperfect tool in the control of transmission. It is more expensive, less effective than primary prevention. Secondary prevention is like last 45 days में भागते हुए पढ़ाई करना secondary prevention है. क्या होगा? वो बहुत costly हो जाएगा. Try primordial preferably. MBBS final year only. You finish 65,000 points by Dr. Murali Bharadwaj from 19 subjects in 2,500 pages. मास्टर करो एमबीबीएस में गोल्ड मेडल मिलेगा, एंट्रेंस का प्रिपरेशन रेडी हो जाएगा, इंटर्नशिप में इंटर्नशिप सही तरफ कर सकते हो, शादी कर सकते हो, बच्चों को पैदा कर सकते हो, शांति के साथ टॉपर बन सकते हो, राइट? सो दैट इज मच बेटर. प्राइमोर्डियल, राइट? एटलीस्ट अभी प्राइमरी करो ताकि नेक्स्ट 48 वीक्स आई एम गोइंग टू मी एंड a lot of wonderful teachers. If you are there in Hyderabad, Nampalli and nearby, please come every day evening 6 to 8 p.m. We have a live class, doctor, live class. Now, secondary prevention is an important prevention for TB, leprosy, STDs, all these communicable diseases, early diagnosis, treatment. That's the reason MDT, DOTS therapy, they're all very effective. Tertiary is when the disease has advanced beyond the early stages. So mainly idea is to decrease the impairment, decrease the disability, minimize the suffering. That is the whole purpose of tertiary level of prevention. So what is meant by disability limitation? It means it prevents the transition of the disease from impairment stage to handicap. Impairment stage to handicap. So what is impairment? What is handicap? If I ask you a question in the ward rounds, for the gram-negative organisms, what is the drug of choice? If you are unable to answer, at most your classmates don't laugh because they too don't know the answer. Only the professor knows because he had been asking that question so many years. Maximum, that is impairment. But actually, you have a patient of gram-negative sepsis. You don't know how to start the treatment. That is a true handicap because डॉक्टर होने से ग्राम नेगेटिव इन्फेक्शन को ट्रीटमेंट नहीं मालूम है तो अपमान है, खाली अपमान ही नहीं, suicidal. So impairment is different, handicap is different. We'll come to those definitions. So disability limitation under tertiary prevention mainly is to prevent the transition of the disease from being an impairment to a handicap altogether. So physiotherapy you do in poliomyelitis. By that what will happen? You may not be able to bring the original limb, but you are limiting the disability. That's the point you need to basically remember. Example of disability limitation. Rehabilitation. It is the training, retraining of an individual to the highest possible level of functional ability. It can be medical rehabilitation, vocational, social, psychological, any kind of rehabilitation, right? So somebody got COVID, went to ventilator, came back. He is in a severe depression, unable to sleep in the night. He requires a psychological rehabilitation. Somebody got COVID, lost the job, and he could not pay the fee to his children, to the school. Children could not go to school. He required a social rehabilitation, right? So medical, vocational, social, psychological rehabilitation all come under rehabilitation. We use crutches in poliomyelitis, example of rehabilitation. That's what you need to remember. Then tertiary level of prevention means late pathogenesis phase. You are trying to intervene. Tertiary level of prevention. For example, somebody got stroke. If he receives physiotherapy, good. If he does not receive physiotherapy, what will happen? Typically, the person will get permanent atrophy of the muscles, is what you need to remember. So that is how Rohit Sharma has made a century, 100 runs. We'll take 2 minutes break. Let's breathe. Another 35 points. I finished it. My goal is every day to finish 300 points. Same 100 points if I have to teach to the wall in my home, painful. Maybe students don't know it is painful. Painful. But with the smiling face of Teja, Dr. Teja only, no? Dr. Teja from which college? Bhaskara Medical College in the classroom in Nampally Center. It's a pleasure, right? It's like meeting a classmate to do the revision. Shortly, Anusha, Sana, everyone is going to join this face-to-face session in the evening so that it will be more interesting classroom with a lot of people. Give 2 minutes break. I'll please stay online. Can you check whether the voice is coming on the YouTube? YouTube. So, welcome back to this wonderful beginning of preventive medicine. Now, doctor, some of the common MCQs in the tomorrow's entrance. 43-year-old patient with fever and cough, more than 5 weeks, comes to the DOTS clinic for the sputum for AFB. What do you like to call this as? Early diagnosis. And it's an example of secondary level of prevention, because you are trying to check the AFB, confirm that he is a case of TB, and making a early diagnosis is basically called secondary level of prevention. Now, another common MCQ. 38-year-old patient with sputum positive for AFB, categorized as category 1 under, of course, category 1, 2 is all removed. Under revised national tuberculosis program, he was started with intensive phase drugs. So what is the intervention you are doing? Treatment. Under secondary level of prevention. So put off the AC for a while. Because already the disease has been diagnosed and now treatment has been started. So that is secondary level. Next comes 28-year-old patient with fever, chills, comes to malaria clinic for peripheral smear. It is also early diagnosis, because you are doing smear and diagnosing him as a case of malaria. And it is a secondary level of prevention, because the disease has set already in the peripheral smear if you detect the malarial parasite, and you are only confirming. So early diagnosis and treatment. Then a 42-year-old with fever and chills comes to malaria clinic and was given presumptive treatment, radical treatment. So what is the intervention you are doing? Treatment. So it comes under early diagnosis and treatment. That's also secondary level of prevention is what you need to remember. 23-year-old from a village in Bihar sleeps inside the bed net, medicated net. With whom? Don't ask me. With whoever it is, right? So it is a specific protection. Protection for what? Not against becoming pregnant. So specific protection against being mosquito bitten, right? So specific protection comes under primary level of prevention. Mosquitoes are already present, but the disease has not yet taken place. So you are preventing mosquitoes from the risk factor from getting acquired. That's the reason it is a primary level of prevention, right? Then a 6-month-old child coming to the immunization clinic for OPV vaccine. So that is an example of specific protection. Vaccines. One more thing is under specific protection. What is that? Contraception. Very good. Very good. See, lifetime you need not revise this point. So throw it into that already known point bin. 2000 points can go there out of this 4,500. So preparation is very simple, doctor. Then primary level of prevention, this comes under. Specific protection is a part of it, right? Then a PSC nurse was employed to screen diabetics in the community using a urine strip for sugar detection. That also is making a early diagnosis, which comes under secondary level of prevention. A multi-purpose health worker organized a camp in the village community and has given a health education on how to prevent the spread of malaria. And that comes under health promotion, which is one of the interventions of primary level prevention. Barabar? So tomorrow's entrance, definitely one question comes on level of prevention. And you will remember me in the exam hall, right? Then a 16-year-old male takes chemoprophylaxis during an epidemic of meningococcal meningitis. So it is also an example of specific protection. And it is a primary level of prevention, is what you need to remember. A 7-year-old child in a class is discouraged from adopting harmful lifestyles. Smoking, more than smoking, is watching iPad. Nowadays, it's very difficult to stop kids from this gadget behavior. It is a primordial level of prevention because smoking has not yet started before the emergence of the risk factor. So that comes under primordial prevention, is what you need to remember. I'm so happy to see 6 online classmates. Once more, doctor, every day, Monday, Tuesday, Wednesday, Saturday. So Monday to Saturday, every day evening. Please inform all your friends. Right? 6 p.m. to 8 p.m. Dr. Murali Bharadwaj will do revision of 200 points. So if we go at this rate, 4,500 points require 22 days for us to finish preventive medicine and tell the world, hey, I'm done with preventive medicine. And you should score 20 out of 20 marks in the tomorrow's NEET PG after you finish this 4,500. So totally 65,000 points from 19 subjects. You will do revision in totally 48 weeks, Monday to Saturday. And every Sunday, please don't forget, if you are in Hyderabad, please do come to the center. If you are there anywhere in the country, you have online test also, and also live online discussion. Taking test is not enough. Discussing 200 questions is important, right? Every Sunday, religiously, like I run a church, just like running a church and a priest in the church, there is a mass to discuss the paper. Do self-correction of the physical paper, printed paper. At least know where you are scoring, right? That's important. So please do come. Next, doctor, a 12-year-old child afflicted with poliomyelitis is given crutches to walk. Crutches is rehabilitation. Oh, I'm sorry. So, crutches is an example of rehabilitation. Yeah. Crutches is an example of rehabilitation. Yes. And rehabilitation comes under tertiary level of prevention. It prevents the impairment, limits the disability, is what you need to remember. Huh? I got it. Yeah. So, impairment and disability and handicap, they are the ones which are limited. 1 minute. Right. Now, doctor, there are some definitions we need to be very clear. Disease क्या होता है? Any abnormal condition of an organism that impairs the function. लिवर काम नहीं कर रहे, दिल काम नहीं कर रहे, कंजेस्टिव हार्ट फेल्यूर हो गया, impairs the function is called disease. Any loss or abnormality of a psychological, physiological, or an anatomical structure or function is impairment. Agreed? Please don't forget. Then disability. Because of the impairment, if there is any restriction to perform an activity which is considered normal for human being, is called disability. Nowadays, I am doing maths every day, 1 hour, 8th class. My younger son is in 8th class. It's interesting to once more do rational numbers, then polynomials and all that, trigonometry and all that. What I found is, if the child cannot do maths calculations, adding, subtracting, multiplication, division in the mind, he will remain with permanent disability to compute. Maths become a devil. So also, lot of medical students, anatomy days, if they don't read thoroughly embryology and all that, physiology, that will once more reflect in pharmacology. If you don't know physiology of kidney, how can you master pharmacology? Very difficult. If you don't master pharmacology, that disability will creep into your medicine, and that lead to impairment of medicine, right? So disability lead to inability to perform an activity in a range which is considered normal for that particular human being of that age. Handicap. So basically, because of that impairment and the disability, if he is unable to fulfill his role, for example, if the person has a spinal cord injury, he is unable to perform sex. Similarly, if a limb is lost, then he can't work as a dancer. So, depending on the age, sex, social, cultural factors, if he can't perform the normal functions, that becomes a handicap where his livelihood got affected. So, examples. One of the favorite MCQ. Accident is a disease because it impairs the function of a person. Loss of the foot is a impairment because there is a loss of anatomical structure in the form of foot. And because of the loss of the foot, he cannot walk, is a disability because walking is a normal routine daily activity of a human being. Because of that, he got unemployed, loses his job because he cannot walk, so cannot fulfill his role in the society. He can't earn. That all became handicap, right? So, doctor not able to know 65,000 high-yield facts needed for the tomorrow's entrance exam and unable to understand them is accident, disease. And because of that, your ability to answer the MCQs which are supposed to be answered correctly, you are not able to answer. Wo kya ho gaya? Impairment. And because of that impairment, you are supposed to get at least out of 200 MCQs, 4 marks each. 4 marks. So 800 marks. At least you should get 600 plus score. So your scores are low. Walking is normal. Getting good score is normal. That is not happening. And because of that, you could not get the seat. Is because of that poor performance in entrance, not getting seat is still not handicap. Your girlfriend leaving you because you did not get the seat is the real handicap, right? So, doctor, time distribution of the disease is one of the favorite areas of the examiner. We have short-term fluctuations, long-term fluctuations of a disease occurrence, and the periodic fluctuations, which you have to be 100% sure about. So, doctor, short-term fluctuation, epidemic is a short-term fluctuation. It is the occurrence. What is the definition of an occurrence of epidemic? Epidemic is occurrence of number of cases of a disease more than the normal expectancy. That is called epidemic, right? So, what is the definition of normal expectancy? You take the average of the number of cases in the past 3 to 5 years in a given geographical area will give you normal expectancy, and anything more than that normal expectancy is called epidemic in that geographic area. So if the normal expectancy sometimes is 0, for example, polio. In Hyderabad, for example, polio did not happen in the last 3 years, average is 0. Then even one case of polio becomes an epidemic. That's the point you need to appreciate. But generally, statistically speaking, what is the typical number to call epidemic? It is the number of cases that are happening in the normal expectancy, right? I mean, number of cases that are happening, or if they are more than the mean value. Your normal expectancy is the mean of 3 years, past 3 years cases. That mean value plus 2 standard deviations, if number of cases occur, that defines the epidemic. For example, if the mean value is 100 and 10 is the standard deviation, so 10 into 2 is 120. I mean 20. 100 plus 20 is equal to 120. So more than 120 will become epidemic. Barabar? So what are the types of epidemics? Common source epidemic, propagated epidemic, that's how we define, and slow modern epidemic. The slow modern epidemic is also called prosdemics. So common source epidemic can be of 2 types: single exposure, otherwise called point source epidemic, or continuous or multiple exposure epidemic is what you need to basically understand. Then propagated epidemic is one of the examples is our COVID. Person to person. So that can happen with person to person, or because of the mosquito to person, or it can be because of an animal reservoir to the person. Anything can lead to propagation. Then you have slow, smoldering epidemic. Now, doctor, if you look at the fluctuations can be seasonal or they can be long term, which is called secular. Secular trend means long term fluctuation. So seasonal trend means if you look at the salmonella or influenza, the moment winter comes, spring comes, if the disease happen to increase, that is called as seasonal trend. Whereas, so why seasonal trend occur? Suddenly when it is raining, rain start, you get cold, influenza, right? With the winter, you get cold. So seasonal trend is mainly because of the variation in the vector, because the environmental factors, humidity, etc., will make the droplets more frequently transmitted. That's the reason. Or change in herd immunity. For example, you are having a place like China, right? So in China, people who got COVID, everyone got COVID. Then they also got immunity, and their herd immunity is very high. So they don't have much of COVID. But one of that guy gone to London, and there the number of people who are vaccinated yet are not that big. So herd immunity is low. Suddenly new cases added. That makes the emergence once more. So seasonal trend is because of what? variation vector, Omicron become Dimicron, become Timicron, vector variation, environmental factors, change in the herd immunity. Any of the three can cause seasonal trend. Example of seasonal trend: measles in the early spring, upper respiratory infections in winter, summers में GIT. समर आते ही हम जाके शरबत पीते ही डायरिया आते. हाँ, simple. Then cyclic trend. It is the occurrence of the disease in cycles which are spread. What is a cycle? It is a short period of time which can be few days, few weeks, few months, few years. Anything can be a cycle, right? So cyclical trend. Sorry. Oh. So cyclical trend. So what is a cyclical trend? Cycles can be short period of time, days, weeks, months, or years. So measles occur every 2 to 3 years. Measles is spread every 2 to 3 years. Rubella spreads every 6 to 9 years. Influenza every 10 to 15 years. That becomes a cyclical trend. Then secular trend means very long-term fluctuation. It implies the occurrence of the disease, either a progressive increase or a decrease over a very long period, over several years or decades. That become long-term fluctuation is what you need to remember. So long-term fluctuation is consistent to the tendency in a particular direction. For example, worldwide, what happened our life? Sedentary. We sit before computers. We go to shadi.com to marry. We go to video conference to have romance on the weekend. So finally what happened? We are sitting before computer. We become fat. The more and more we become fat, abdominal, truncal obesity increases. That increases reflux esophagitis. That increases esophageal carcinoma. So esophageal carcinoma had been progressively over a period of time in an increasing trend, right? Because of that obesity, our arthritis is increasing. Because of the obesity, our diabetes is increasing. Every third person in Hyderabad is becoming diabetic after 40. So that's the long-term fluctuation, secular trends. So example of long-term fluctuations, secular trends are in communicable diseases. Like poliomyelitis is diminishing, diphtheria diminishing, pertussis diminishing in the past few decades because of the effective vaccination. Diabetes, hypertension, obesity, they are increasing in the past few decades is what you need to remember. So, doctor, that brings us to the end of our saga to our PSM preparation started. Once more, tomorrow evening, 6 o'clock, please bring another 100 friends of you. We will continue and we will give you the notes and you combine some passive learning, listening, forgetting, and some active learning. You sit and prepare. So both the things combined, you will get to see. Yeah. Thank you very much.